honorable judges, respected panelists, and learned audience, very good afternoon and welcome to everybody on today's special day. And this is a very special day, and this month is also very special. All of us, we know that. Today, I'd like to going to present a couple of cases where echocardiography has a great role for the diagnosis of cardiac disorder. My first case, a 25 years old adult who presented with shortness of breath and history of 2 episodes of cardiac syncope. On examination, he had tachycardia with low blood pressure, and pericardial examination revealed faster sound loud and a mid-diastolic murmur, more marked in the tricuspid area in the sitting posture. And this is the echocardiogram, and putting the probe of the echo where we found that a large mass in the right atrium of it protruding to the RV, and there is a minimal pericardial effusion. By consultation of the cardiac surgeon, and he underwent operation, and after that operation, his echo revealed completely normal study. My next case, a 35 years old diabetic lady. She had history of hysterectomy due to incomplete abortion, and after that, she developed high-grade fever with chills and rigor, and she had hectic temperature. On pericardial examination, found faster sound soft and a pansystolic murmur, and during her echo evaluation revealed there is a large vegetation in occupying the anterior posterior mitral leaflet and giving rise to severe MR. For further evaluation, she was found a case of culture positive blood culture revealed Enterococcus faecalis, and according to culture sensitivity, we undergo treatment by giving vancomycin and amyloid glycoside, and after that, her echo revealed completely normal. My third case, a 65 years old gentleman who was diabetic and diagnosed with COVID-19. She presented on 8th day in our emergency with severe breathlessness and chest pain. And during his evaluation, she was found cyanosed and collapsed. And at the time, he undergo cardiac arrest. And after resuscitation, the ECG revealed SnQ3 T3. And when we do a bedside echo, which revealed RV was dilated, and there is a large thrombus in the sidal thrombus in the main pulmonary artery. And according to the guideline, we treated him and by unfractionated heparin drip and giving alteplase. And after that, his echo revealed absolutely normal. And case 4, a 35 years old banker. He presented to us with progressive shortness of breath, generalized swelling, and features of right heart failure. For the couple of last 2 years, he was visited into different physician, but he was not properly evaluated, and echo revealed, ECG revealed bifascicular block. And when we had done an echo, it showed the RV was dilated, D-shaped LV, and RRV was dilated. He undergone transesophageal echo, but there was no interictal septal defect, and severe pulmonary hypertension, moderate RV systolic dysfunction. This echo guided us for further evaluation, and further evaluation we had found that there is a CTPS showed there is an organized thrombus in the main pulmonary artery. He undergo operation and pulmonary endarterectomy. After that, his echo revealed absolutely normal. And next case, case 5, a 60 years old female who presented to emergency department with severe shortness of breath, chest heaviness and dizzy. During her evaluation, she was found tachycardia with extremely low blood pressure. Her JBP was raised and heart sound was absent, and apex beat was not palpable. And ECG was done, show the low voltage ECG with tachycardia. She carried a chest X-ray, revealed the massive cardiomegaly, and echo showed the swinging motion of the heart, and there is a collapse of the RARV. So immediate pericardiosynthesis was done, but surprisingly the pericardial effusion was found to be a case of hypothyroidism, and anti-TP antibody and anti-thyroid antiglobulin was positive, so she was a case of Hashimoto's thyroiditis. And after treatment, her echo revealed quite good, and no pericardial effusion was found. And this is the last case where a young adult come from the Saudi Arab presented to us with central chest pain and fever for the last 2 days. And this is the ECG, first ECG. By seeing the ECG, she was given a shot of streptokinase. but he was counseled for the angiogram, but as he denied, he was discharged 2 days later without an echocardiogram. And 2 weeks later, he admitted to our hospital with this ECG, and we done an echo, which revealed there is a fibrinous stent, but no regional wall motion abnormality. And after that, we reviewed the ECG again. Actually, this is the ECG of pericarditis. And we undergo pericardiocentesis, and tuberculosis was found. As his chest X-ray was normal, so as a case of extrapulmonary tuberculosis isolated and come from abroad, we further evaluated, and he was also found to be a case of HIV positive. And after that treatment, he was quite good. And my take-home message is that echocardiography has a tremendous role in a cardiac patient for proper diagnostic evaluation. So appropriate use of this test is very much essential even in the primary evaluation. So there is a great talk that finding the right work is the discovery of your own soul in the world. So thank you very much. Thank you for your patience hearing.